Okay, sorry about that, everyone. We had some technical difficulties, but we're going to go ahead and get started now, since we're a little bit behind. My name is Brian Manning. I'm the Communications Manager here at Circle Surrogacy. This is actually our third webinar. It's the first webinar we've offered for residents of the U.S. Just a quick overview of who's on the call today. We've got Doug Danzey, who's the CEO of Circle Surrogacy, Dean Hutchison, who's an attorney here at Circle Surrogacy, and then we're going to have Dr. Vicken Sahakian, who's the Medical Director of Pacific Fertility Center in Los Angeles. And finally, we're going to be joined by Brian and Matt, who are two dads through Circle Surrogacy. And on the docket for today, we're going to talk a little bit about Circle Surrogacy's history and background, describe the difference between gestational surrogacy or GS only versus gestational surrogacy with egg donation, what we call GSED. We'll go over the process of surrogacy and egg donation, discuss our different programs, give you an overview of the legal work, as well as the costs and insurance. Then Dr. Sahakian will take over and describe the medical process. And then, again, we'll have Brian and Matt talk about their own experience. Just some basic housekeeping. You should already know this since you're listening to the call, but there are two different ways to listen in. One is by telephone, or another option is to use your computer speakers. And if you want to change that, you can do that in the audio panel of that window to your right. You'll have an opportunity to ask any questions you'd like by typing them in the questions pane. And we'll get to those at the end of the presentation. I also wanted to let you know that we're going to be recording the webinar and that we'll be able to email it to you at the end. So without further ado, I'd like to introduce Doug Danzey, who's the CEO of Circle Surrogacy.
Hello. As Brian said, Doug Danzey from Circle Surrogacy. I'm the CEO, and I'm also a parent through surrogacy. Tell you a little bit about Circle Surrogacy. We're one of the oldest and largest surrogacy agencies in the world. And John Weltman, who is the president and founder, is recognized worldwide as the expert in reproductive law, including surrogacy and gay parenting. He began his surrogacy legal work in 1992 and founded Circle Surrogacy in 1995. John is also a father through surrogacy, as I am, and he has two grown sons, now finished high school and into college. We're going to talk a little bit about Circle Surrogacy and then the agency, and then go into some of the programs in our process. We have 100% success with parents in surrogacy, and that is just based on you following our guidance throughout the journey. Parents that follow our guidance basically end up having a child or children, and they're very happy with our agency as a whole. When I say follow our guidance, because there's a number of moving parts throughout the surrogacy journey, and we've been doing this for almost 18 years, and we know how to create families and add to families and how to basically have children. There's a couple of variables that we don't control. We're a full-service agency. However, we can't necessarily control the cost of IVF, and you can talk to Dr. Sahakian about that in a little more detail. He'll go over these things, but there's a guarantee program, and there's an unlimited IVF program that we would talk to you about in a consultation with either Dr. Sahakian or a consultation when you sign up with Circle Surrogacy. We're going to estimate $125,000 for a journey, and we like to keep that estimate within that range. We don't ever want a parent telling us it costs them a significant amount of money more at the end of their journey when they are at home with their children. So we ask people to work with clinics like Pacific Fertility and Dr. Sahakian because they know how to work with an agency. They know how to control the costs. They're going to tell you what programs to use with IVF in order to keep the cost within line and keep within the range that we're telling you that it's going to cost. surrogacy journey average is going to take anywhere between 15 to 22 months, and we're also going to try to keep you within that window. Working with a full-service agency, it's very important that you know that basically Circle Surrogacy has all of us under one roof. So we have our social workers, we have our clinicians, we have our legal team and our lawyers, which is very important, our accounting, all under one roof. And then we partner with Pacific Fertility and rely on their expertise to get the IVF piece done. We work with intended parents from all backgrounds. We work with HIV-positive intended parents through the SPAR program. We have an emphasis on egg donation and what that really, known egg donation, and what that really means is we really recommend that our parents work with egg donors that are willing to be known. My personal experience, I just went too quickly, is 8 years ago when I began my surrogacy journey. With my oldest son, I chose an anonymous donor, trying to keep things simple and uncomplicated. And when he turned 6, and within first grade, he came home and hit me with a lot of really difficult questions. Basically wanted to know who his biological mom was. I never anticipated being hit with those questions at age 6. It was rather difficult for me, and for 3 weeks, day after day, my son had more questions about who his biological mom was. And I had some information, but I couldn't do the one thing that he wanted, which was introduce her to him and have him meet her. So I actually did some research and was able to get connected with the fertility clinic that I used at that time for egg donation. And with a happy ending in the end, I found her. She was willing to be known. She met my children, and I now am able to have my children contact her or be in touch with her when they need her. So it was a happy ending in the end. You can limit the amount of contact you have through contract. Dean will go into that probably in a little more detail, and you would also go through that in a consultation if you take this further. We're a relationship-oriented agency. We want to make sure that your relationship with your surrogate is strong and communicative through the whole journey. We also encourage relationships after your children are born. We're here to support you through the entire process, and we're looking at the long-term results and long-term planning throughout your journey. There are 3 components of the surrogacy journey that I'm going to touch upon as I go through this and talk to you about the different steps. Communication is critical. One of the reasons why Circle Surrogacy is so successful is that because we are all under one roof, we're communicating with each other on a regular basis regarding your journey, and it enables you to communicate with us as well. Trust is huge. You need to be able to trust us. We've been doing this for almost 18 years. We know how to create families and how to have successful journeys. And then control, or I should say letting go of control, is a huge piece of and component to the surrogacy journey. I'm going to talk about how you need to trust your surrogate. You're going to have a woman that's basically carrying your child that could be in another state from where you live. You need to be able to trust her and know that she's doing the right thing. I'm going to talk to you about our screening process a little bit so that you have an understanding of what we go through when we screen our surrogates. We'll talk to you a little bit about gestational surrogacy and gestational surrogacy with egg donation, because not everyone needs an egg donor. Gestational surrogacy, basically, you're going to provide all of the needed biology to create the embryos, but you're going to need to require the assistance of a gestational surrogate. In that case, we would be providing the gestational surrogate for you, and we would work with you through the journey, matching you with the gestational surrogate as far as legally is concerned, and also, psychologically and emotionally, we're going to make sure that the fit is there for you. When you're working with the gestational surrogate and egg donation, you're going to need to select an egg donor, and I'll talk to you a little bit more about that. And Circle Egg Donation has a number of egg donors. Like I said, we promote known egg donation, so all of our egg donors in Circle Egg Donation are willing to be known. And then you'd be matched with your gestational surrogate and move on with your journey. Once you have the consultation with us, you're going to have the consultation, and once you decide that you want to move forward and we decided it's a good fit, and you would take it to the next step, which would then be telling us that you want to sign on with us. You would sign on and make your initial deposit into the trust account, and then we would welcome you to Circle Surrogacy as an official member of our Circle team and our Circle family. The first thing that would happen would we would introduce you to our clinical director, Emily, and then Emily would align you with the program coordinator. The program coordinator's role in business terms is more like someone like a project manager. She's going to make sure that you stay on track and everything is aligned so that you stay within the 15 to 22 months that we're projecting as far as your journey is concerned. The first thing that she's going to do is she's going to make sure that your profile is complete. Because when we match you with a surrogate, we're going to not only present the surrogate's profile to you, but we're going to provide the profile of you and your partner, if you have one, or your husband or wife, to the surrogate as well. I ask our surrogates, our parents, to write a letter when I do a consultation to the surrogate, so you should start thinking about that at the very beginning. Our surrogates are doing this because they want to help families have children. They want to help you have children. They want to help you grow your family or create your family. We need parents to speak to the heart of the surrogate from their heart and write a letter just basically saying who you are and why they would want to work with you. In addition to that, there's going to be a profile that you'll complete and then some photographs that you'll provide us. Up to seven photographs is the minimum. So once your profile is complete, your program coordinator is going to then make sure that you're aligned with the clinic. The reason why it's so important to be aligned with the clinic from the very beginning is your doctor from the clinic, like Dr. Sahakian, is going to be reviewing medical records early on when we're actually working on matching you with a surrogate. So we're going to review your medical records, and then we're going to move them on to Dr. Sahakian for a further review. And once he gives approval, then we're actually going to move her on in the screening process. The next step after aligning you with the clinic would be to make sure that if you were using an egg donor, that you were looking at egg donor profiles and getting yourself ready to select an egg donor. Now, depending upon whether you're doing a fresh embryo transfer or frozen embryo transfer, and those details we would go into further with a consultation with either Dr. Sahakian or with ourselves further down the line. That would actually dictate the timing of when you select your egg donor. Now, our egg donors, their requirements, they have to be between 20 and 29 years of age. They need to have a body mass index no higher than 30. They have to have a healthy family history, no use of illegal drugs or cigarettes and alcohol abuse, and they have to have a minimum of a high school degree. So you would align yourself with an egg donor, you would get that agreement signed, and then you would be waiting whatever amount of time that we had projected for you to be matched with a surrogate, and that's going to depend upon a lot of different criteria, which we would go through with you in the consultation. Our surrogates, basically, you need to know that we approve less than 2% of our applicants that apply with us. So when I talk about the trust piece of this, and I tell you that our surrogates have been screened and we've done a really thorough job, we have the world's best matching agency. What's going to happen is they're going to have to go through the process of being screened. We have a pre-screening team that's made up of 2 women that have been surrogates before. They're going to need to provide medical records. They're going to meet with our social workers and have a psychosocial assessment. They and their support person are also going to have a criminal background check. They're going to meet with our clinical psychologists on our team, and they're going to have a psychological test, and the one that we use is called an MMPI. And then after they've gone through all that rigorous screening, then they're going to sign a commitment letter with us, because often surrogates also apply with other agencies. And they're going to commit to working with Circle, and then we're going to move them forward, and we're going to present them to you. Our surrogates, it's very important that you know that they, in addition to that, part of the screening, we're going to make sure that they're not using drugs, that they're not smoking, that they're not abusing alcohol, all the basic questions that you would ask. Once you're aligned with the surrogate, then you're going to continue with your journey. You're going to have a transfer, whether it's fresh or frozen, and then you're going to go through your beta testing. And I think that Dr. Sahakian is going to talk to you a little bit about the process as far as the clinic is concerned after the transfer. And then at week 26, we're going to ask you to have an orientation with the hospital and meet the doctors and be there for an ultrasound. And then at your delivery, you're going to hold your baby in your arms and forget everything that happened in your journey. So from this point on, I'm going to introduce you to Dean Hutchison, and he's going to talk to you a little bit about the legal work.
Hi, my name is Dean Hutchison, and I'm an attorney here at Circle Surrogacy. I'll give you a quick background on myself before I start the presentation itself. But I've been with Circle indirectly or directly, really, from my entire 12-year legal career. I started with Circle as a law clerk out of law school, where I was there for about a year doing contracts and doing pre-birth orders, adoptions, etc. I then took a job with a law firm Circle was affiliated with for about 6 years, and then took a full-time job within Circle roughly 3 years ago in the legal department. I have the kind of cool job of being with you not only at the outset of the journey, doing the consultations and working with you on the agreement for services. I manage the matching process to make sure you're matched in a state where legally works for the carrier as well as you. And then I manage that legal work at the end of the line, so I'm assisting with getting your parentage rights complete in either the state where the carrier is or your home state. So I'll go over today roughly what I go over in the consult, but on a brief basis of different topics, including the legal work, the insurance portion, and the financial portion. I commend you for making this first step, but you can, if you want to take the next step, which is a full consultation, there'll be a contact at the end of this presentation that you can take down and reach out to. So first, just in a general context, I just want to briefly go over the benefits or the positive stance on surrogacy in the United States. Really, there's 44 states where surrogacy is practiced. There's only 6 where it isn't, and it's a very receptive. It's tough to find a hospital in these states that hasn't had a surrogacy birth in the United States. We don't have issues like we did maybe 5 to 10 years ago with hospitals not understanding what's going on. It's a very receptive society. Clients say that they're nervous when they get to the airports, when they get to the hospitals, and they don't face any issues anymore. It's not like it used to be. Everyone's biggest fear, of course, because every TV show, movie, and book about surrogacy is the surrogate stealing the child or keeping the child for ransom, but it really doesn't happen. The few times it's happened, the appellate case law has found all the rights to be within the genetic parents. Really, there's a California decision from the 90s that stood for this proposition that when a carrier has no genetic link to the child, where she signs an agreement prior to getting pregnant that she has no right to the child, that the court's going to find she has no right to the child. The couple states that have actually had bad case law, we would never match you in those states with a carrier because even though people do work in those states, we wouldn't want you to be a test case scenario. Also, the process is pretty simple in your own travel. Doug went over it briefly, but you're going to go to the clinic once or twice, once to do samples and create embryos, once potentially for a transfer. You're going to travel to the carrier's home state for the ultrasound if you want to go and you're able to go. and then for the birth. So the travel can be managed pretty easily. So as Doug mentioned, not only do we have a full support team from social work and attorney coordination setting, but we have a full legal team here at Circle. Really, we have a law firm inside of Circle Surrogacy. We have 6 licensed attorneys on staff. John Weltman, as Doug mentioned, has been practicing law for over 30 years, has had a niche in this area for over 20, speaks at national, international conferences. Scott Buckley, our legal director, has been with Circle his entire 11-year legal career, also speaks at national, international conferences on different topics. Myself has been with Circle pretty much that in my entire 11-year legal career. Gina Marie, who does our contracts, has been with Circle since her first day at law school. She's a licensed attorney. We have multiple law clerks on staff at all times, and then we have 2 other licensed attorneys, one in our parent outreach program and one in our surrogate screening program. So there's always someone with a legal background here if any issues do arise during your journey. And Doug may have mentioned or not, we have a 24/7 emergency hotline at Circle that I can speak from experience, does get answered and does get responded to rather quickly, usually within an hour or 2, depending on the state of the emergency. And it's not to scare you into thinking there's lots of emergencies. Sometimes parents think it's an emergency when it's not, but it's usually a simple question that has to be worked out with the hospital or something to that effect. For all of our clients, we have what we call an individualized legal plan. We're going to have, obviously clients coming from different backgrounds, same-sex couples, hetero couples, using donors, not using donors, and we set up a legal plan that exactly is what you need. Most states have 3 options, or one of the 3 options. There's states which have what's called pre-birth orders. As titled, it's a court order coming prior to birth, giving either one parent or both parents full legal rights to the child, telling the hospital to treat them as the parents, and then telling the state to create a birth certificate with both of them on it. There's states that have very similar orders, but there must be a live birth in order for that order to come through. So it's the same process. It's just filed, within a couple days of birth. And then there's a couple states where the best method is to do a post-birth adoption immediately. Therefore, so whoever the biological parent is goes on the birth certificate immediately, and then the second parent would go on through this post-birth adoption. It just really depends on. We're going to match you in a state where we can do exactly what you're looking for. So it's not that you're going to be stuck with one legal process or the other. You tell us in advance what you definitely want, and we would match you accordingly. Usually the law where the carrier lives is what applies to these contracts, because that's where the birth certificate is going to be made. That's where the baby's going to be born. But for some of our other couples that, especially same-sex couples coming from states where they can do an adoption back home, your home state also comes into play with when we match you and how we want to match you and what we want the legal work to look like. There are 6 states and territories where we don't get carriers from. They're listed here. Washington State, Washington, D.C., Nebraska, Michigan, New York, and New Jersey. Some have outright prohibitions on surrogacy. Other ones just have bad case law on them. So we wouldn't match you in those states. It does look like New York and New Jersey, and as well as Washington State, may be changing their laws soon. But until they get changed, we wouldn't match you. So on top of that legal work to create your parentage rights, the other legal work that's done is really the agreements. There's an agreement for services with Circle that you can either negotiate on your own behalf, or you can have hire counsel to do it. People do it both ways. We'll send you the contracts prior to consultation so you can see them and ask questions directly about it. We would then become your attorney of record once you sign on with us for the negotiation of the carrier agreement with the carrier. She's going to have her own separate independent counsel, so she's advised by someone outside of Circle. And then if you need a donor, egg donor as well, there'll be a separate agreement with that egg donor that we would draft on your behalf, review it with you, send to the egg donor's attorney, and negotiate on your behalf. So as Doug mentioned, there's many program options, and they all come into play with how the legal work's done, et cetera, or what your exact needs are. But clinics like Pacific Fertility that you're going to hear from Dr. Sahakian have different plans where instead of paying to create embryos and then paying for transfer, they have an unlimited plan where you're pay one set price that covers all the amount of transfers it takes to get pregnant. There's obviously gestational surrogacy when you're using your own sperm and egg. There's gestational surrogacy using a donor. And then there's a couple clinics that have frozen egg banks available, so you purchase a set of eggs that's already available and fertilize those eggs. And then for clients that just need egg donation, we also have a full-service egg donation agency underneath Circle, where if you're solely here for egg donation, you can just choose a donor and work with your clinic. So again, on a brief scale, the cost associated with surrogacy really depends on exactly what you're looking for, so it's tough to go into it in depth in this very general background. It varies program by program. It varies if you need a donor or you don't need a donor. But roughly, without the cost of IVF included, the programs range from about $65,000 to $100,000. As Doug mentioned, usually we like to estimate anywhere, if you're GS only to GSED, somewhere in the 120 to 140 range. But again, it's going to totally depend on which program you need. The website that's on, the link that's on this page, you can go to and look at the different programs and see what the cost estimates are. I will tell you that the only estimate that's not included in these cost sheets is your own travel, just because we have clients coming from all over the world, all over the states. So that price is going to be different depending upon your own wants and needs. And I'll tell you also, we have clients that fly out the night the baby's discharged from the hospital, and they're not even in a hotel for 1 or 2 nights. And we have clients that stay for a month where the baby's born just to get acclimated before returning home. So that's why that estimate is not included. So the other big option, or big decision in surrogacy has to do with insurance. When we talk about insurance, there's usually 2 insurances in play. There's insurance for carrier for her pregnancy and delivery-related expenses, and there's insurance for the child or children to be born. For our U.S. couples, if you have your own primary insurance plan in place already, any child born to the surrogate, you can immediately place upon your insurance just by calling your employer or your insurance company. You just want a couple things to look out for when you're doing it is just to make sure there's coverage outside of your home state for all medical care, and depending upon who the biological child, who the biological father is, may depend upon whose insurance covers. Different with the carrier, as insurance, as surrogacy got more and more, not popular, but became more out there in the mainstream with different stories on different TV shows about it. Our U.S.-based insurance companies have begun to exclude coverage for maternity in women's policies. So the majority of the carriers we see don't have good insurance for surrogacy, but in that same kind of time frame as insurance companies began to exclude coverage, a couple insurance companies began, one called Universal Family, one called New Life Insurance, that have a plan you can purchase for surrogacy-based maternity coverage. And that's something we would discuss with you in the consult, and we would help you put in place when you, if and when you do sign on. There's a couple other small pieces of insurance that we have our clients purchase during the journey. There's going to be a complications insurance you purchase for the egg donor and the carrier during the retrieval and transfer process. And then all carriers, we require that you put a life insurance policy in place for them when they're deemed pregnant. And that policy is a surrogacy-based maternity coverage. These 3 policies are very low premiums. I think the complications are about $300. The life insurance about $600. So, after tonight, if you feel like you want to take the next step and do a consultation with Circle, we advise you to reach out to Bruce Hale, whose contact will be on the next slide. They're free consultations. They last roughly 2.5 hours. We can do them in person in our office, or we travel around the country as well, and if you see where we're going to be, you can meet us there. We're usually in New York every month, on the West Coast every couple months. We also do them via Skype. There'll be a kind of a social work portion where we'll get to know you more and tell you more about the process, and then a legal portion where I go more in depth on the issues we just spoke about. And really just to tell you about more in depth about Circle and why we think an agency is better, a full service agency, et cetera. And you'll get to ask your own questions and raise any things that you might not want to ask in these more private or public forums. You can privately ask. That's the contact to reach out to schedule such a consult. And I'm going to hand this back to Brian, who's going to introduce Dr. Sahakian to you, who'll go over general topics on the IVF process.
Okay, thanks, Dean. I just wanted to point out we've gotten a few questions already. Feel free to go ahead and send those during the course of the presentation. We're just going to save them for the end and just sort of answer them all together. And just bear with me for just a moment. Okay, Dr. Sahakian, are you there?
I am.
All right.
Do I have control of the slides?
Just going to give you control, and you can go ahead. And I'd like to introduce Dr. Sahakian, who is the Medical Director of Pacific Fertility Center, Los Angeles. He's going to talk a little bit about the medical procedures involved in surrogacy and egg donation.
Hi, everyone. Introducing myself. I've been doing this for about 20 years. I'm a reproductive endocrinologist specializing in vitro fertilization and with special emphasis on third-party parenting, which is basically gestational surrogacy and egg donation. To date, I have done over 1,600 IVF cycles involving a surrogate or a donor. And there are thousands of babies out there. I'm going to talk about a practical guide about gestational surrogacy and egg donation, understanding that some of you will only need a surrogate and some of you might need egg donation only. But I want to kind of encompass the whole array of the process. Now I need to move my slides and let's see. Okay, first thing I'm going to touch on is the FDA regulations. In 2005, the FDA came up with regulations which unfortunately don't make much sense, but we have to abide by them. Basically saying that if you will use a surrogate to have a child, you are considered a donor, whether you're the sperm donor or the egg donor. If you're using a surrogate who obviously you're not sexually intimate with, you are considered a donor. The FDA said there are basically two types of donors. There are anonymous donors and there are known donors. If you are a known donor, you have to meet the surrogate, even if it's by Skype, but you have to have knowledge of who the person is. There's no specific guidelines as far as what known means, but Skype call should be enough to be introduced and become a known donor. Anonymous means you will never meet the surrogate, you will never know the surrogate name, or even if you are using an egg donor, you won't know the egg donor name or address, etc. So the FDA said if you are the source of the gametes, sperm or eggs, you have to be tested using specific test kits in a specific testing facility which is approved by the FDA, and the tests need to be done at a specific time. So they put all these restrictions. I still don't know why, because it really doesn't achieve anything, but we have to abide by them. So if you will be using a surrogate, and let's say you will use your sperm, let's talk about the sperm donor. And when I say donor, you could be the intended parent, but you are practically donating sperm to produce embryos that are going to be transferred in a surrogate. So you will need to be tested if you're the sperm source within 7 days of producing a sperm sample that will be used to fertilize eggs, to make embryos, to make the baby. If you are an egg donor, you will need to be tested within 30 days of that procedure of fertilization. And we still don't know why 7 for men and 30 for women, but the bottom line is you have to be tested. If you are not, you cannot use those embryos to transfer on a surrogate in the United States. If you do the testing in a facility which is not approved by the FDA, same thing. You will not be able to use those embryos. So it's very, very important if you are going through this process and you have a physician who's helping you do the IVF treatment to make sure that they're abiding by the FDA guidelines. You could otherwise be in trouble, or your doctor actually could be more in trouble than you. If you will be using an egg donor, the donor can remain anonymous to the surrogate, but needs to follow these testing guidelines. Let me go to the next slide. Let's see, so I'm having trouble moving slides here. I don't know if Brian is there. Here we go. Okay, I'm going to go and explain to you this stepwise approach of how this process is accomplished. As complicated as it sounds, it's actually pretty simple. It might be slightly different than what Circle presented to you, but overall you're going to see it follows the same scheme. The first step in this process, if you are to use a surrogate, you need to choose your agency. Before you pick a doctor, before you find an egg donor, you need to find an agency. Now, you might think I am biased, obviously, towards Circle, and I'm proud to say I am, because I've been doing this for 20 years and I've worked with many agencies, and they are by far the best surrogate agency out there. When you're trying to pick an agency, it's important to look at several criteria. Number one, experience. In this field, especially the field of surrogacy, it is imperative that you pick an agency that has done this hundreds of times with success. They've gone to court, they've done all the legal aspects of the process successfully, and no one has done it more than Circle Surrogacy. Second, reliability. This is where you need to be able to trust, like, they already mentioned that. You need to be able to trust the agency. You're going to be paying $120,000 to do this, and you want to make sure you trust that your money is going to the right place, that there is accountability, and that's important for you when you check into different agencies to get that feel, to basically ask questions, get into the details, to understand the process, and build that trust with the agency. In my opinion, one of the best ways to build that trust is to have accessibility, which means when you call, someone answers. When you email, someone emails back. And you will notice all you need to do is test this. Go and contact multiple agencies and try calling and emailing, and you will immediately realize how quickly, how responsive Circle Surrogacy is. And that's what makes a big difference in trusting an agency. Of course, the final criteria is the cost, and the cost varies between agencies. The range, again, could be between somewhere $70,000 to $100,000. Overall, they're all in that range, but you have to be careful when you look at the cost. Try to compare apples to apples. There are a lot of misleading examples out there. A simple example that will raise your cost is you pick an agency because they're cheaper. Next thing you know, you are matched with a surrogate in 2 weeks. The surrogate sees the physician, and by the way, this happens with me all the time. Surrogate sees the physician, and I examine her, and I realize that she's not a good candidate. So now you've already signed with this agency, you've paid a retainer of probably $30,000, $40,000, and your first surrogate is dropped. Next comes the next surrogate 2 weeks later, same thing. Poor candidate, poor choice, we drop the surrogate again. Now frustration builds, and I've had many occasions where the patient comes in and says, listen, this has been 6 months now, after 3 surrogates, we still don't have a surrogate that's a good candidate to do this. and it's too late to back out. You've spent too much money trying to save money up front, and yet you are basically still exactly at the same point when you were before you started. That's why it's important to pick a surrogate agency that you can trust with experience and reliability. That's step one. Pick your surrogate agency. Next, choosing a surrogate. That's still part of step one. And this is, I'm putting a little bit details here for you, but you don't have to obviously memorize this, but just so that you know what are the criteria that an agency uses, a doctor uses to choose a surrogate. Choosing a surrogate is actually a misnomer. You don't have really that option of choosing from 15 candidates. The agency presents you with a surrogate, they make the best choice for you, and you can certainly say, no, I don't want to work with the surrogate, but that's very unlikely because a good agency presents you usually with a surrogate that's a very good candidate for you. And some of these contraindications, absolute contraindications, meaning that if the surrogate has any one of these, she won't be qualified to be a surrogate. Or for instance, if she's older than 42 and she's never had a baby, or she's grossly overweight, etc. You can read these quickly. You don't have to memorize any of these, but it's a very rigorous screening process to make sure that the surrogate is actually a good candidate. Besides these absolute contraindications, there are some complications related to pregnancy. For instance, you cannot use a surrogate who had hypertension, or there was growth retardation, or preterm labor. Similarly, there are conditions where I call them relative contraindications, whereby you still cannot use a surrogate in most circumstances. For instance, if the surrogate has thyroid disease that's untreated, or severe asthma, or multiple miscarriages. And these are not things that you need to look for, but I wanted to kind of present it to you, some of these criteria used by agencies and doctors to pick a surrogate. Step two is choosing your IVF clinic. Once you have picked the surrogate agency, typically that agency will actually introduce you to some doctors. You don't have to go to those doctors. I say this even as Circle is a witness. You could actually pick Circle, and even though I'm doing this presentation, you can go and find your own IVF doctor, and if it's a reputable doctor that Circle is aware of, you could work with that physician. You don't have to use me as your IVF clinic. When you look at an IVF clinic, again, look at experience. You know, I certainly don't walk on water, and many other clinics don't, or many other doctors don't either. But you need to make sure that the physician is, you know, somewhat experienced, not only in vitro fertilization, but also in the process of egg donation surrogacy, which has its own nuances that can affect success. Success rates are critical, but again, very difficult for you to check on. I can tell you whatever I want. There's really no way for you to check it to make sure that it's truthful. Any physician can tell you anything. And to circumvent that, at Pacific Fertility Center, we came up with the idea a couple of years ago that we need to have the patient really compare apples to apples. And since everyone can say or state a certain success rate, we said, let's basically give a financial incentive that's directly related to success rates. So we came up with financial packages, and I'm certainly not going into detail into those packages. We can do that for you at a later date if you're interested, because I want it to be more of a medical presentation than a financial presentation, but I need to touch on this. And basically, we came up with financial packages or incentives whereby we tell the patient, listen, if we didn't have high pregnancy rates, we can't offer you these programs. We're telling you unlimited IVF cycles until you have a baby, and you pay one fee, all inclusive. The only way a program can offer such a plan or package is if they have very high success rates. And I will go over the success rates in a little bit. But that's sometimes, unfortunately, the variable that patients use to pick between clinics. So now that you've gone and you've chosen your surrogate agency and you've picked the doctor, there's a time hiatus here. There's a period of time where basically you actually can do nothing. because you're waiting for a match. A surrogate match can take from 3 to 9 months, depending if you're using a surrogate who accepts 2 embryos, transferring 2 embryos on her. If you want a surrogate and are okay with transferring 1 embryo, you might find a surrogate quicker. But if you want 2 embryos, you might have to wait a few more months. So the bottom line, there is a wait time here, where about 3 to 9 months you're going to wait for a surrogate match. I don't recommend personally for you to go ahead and look for an egg donor too soon, because egg donors are not going to wait for you 6 months. What I would say, wait till the agency gives you 2 months notice that there's going to be a match, and then start looking for a donor. Well, what are the criteria, what are the variables when you look at egg donations? First, when do you start looking for a donor? And I touched on that. Basically, a month or 2 before the surrogate match. Where do you look for a donor? Well, all you need to do is Google egg donation, and you'll get 100 sites. In Los Angeles alone, we have about 25 egg donation programs, and there are about probably 40, 50 of them around the state. So it's just, there are a lot of egg donor programs. There are a lot of egg donors you can choose from. Circle Surrogacy has at least 200 to 300 egg donors themselves. You might not even need to go outside Circle to find your donor. It's a simple internet search. The donor profiles are up for you to read. Their medical history, their physical characteristics, their picture, etc. So you can certainly look at those on internet and pick a donor. As far as what you look for a donor, you have to look at certain criteria that are important. Anonymous versus open donation is the first criteria, which means if you want an anonymous donor, then you probably have a bigger choice. If you want to do open donation where you're going to meet the donor, you might have a harder time finding a suitable donor. Certain agencies encourage open donation. Circle is one of them. Hence, they actually try to find donors who are willing to meet intended parents. Age is a very, very important factor in success rates. I prefer donors who are under 30. I prefer donors actually who are under 26. The younger the donor, the higher the success rate. That doesn't mean you can't use a 27, 28-year-old donor, but if you do pick a 28-year-old donor, I have to make sure that that donor is checked and is able to produce multiple eggs. And in many cases, I would recommend for that donor to be a proven donor, which means she's donated before with the knowledge of how many eggs she produced, etc. Physical characteristics are important to intended parents. Some of them obviously are genetic. Height and weight are very genetic, so it might be important for you to look for those features. As far as the genetic and the medical history of the donor, you can be rest assured that most donors that are on donor agency catalogs have already been screened and they don't have anything wrong with them, otherwise they won't be there. I just want to stress one fact about the genetic and medical history of donors. There are some limitations. These are basically history forms that donors filled. We cannot check any of it. We cannot, you ask the question, you hope the donor is truthful about the answer. I don't want to scare anybody, but if you ask the question, is there breast cancer in the family, and the donor says no, and yet there's no way you can check on that. There are no tests for that. So there are limitations when you look at these profiles. So you can be picky, but don't be too picky. I always say you never ask your partner to fill a genetic medical history before you got together. So now that you need an egg donor or a sperm donor, don't be too picky. As far as the location of the donor can be anywhere. Same for the surrogate. The difference is a surrogate has to be in a favorable state. The donor can be really in any state. Certainly, if you pick a donor who doesn't live next to your doctor, add a few $100s in travel costs, but don't make that as an important criterion to pick a donor. Compensation is also critical. Most donors are paid $7,000 to $10,000 to donate. There are some agencies that present you with quote-unquote Ivy League donors, and they want $30,000 to donate. I am against that. I believe that's extortion. I believe that whatever the going rate is the going rate. But if you're going to ask $30,000 to donate your eggs, I'm sure you can find someone cheaper that will give you similar quality genes. So just to recap, step 1, choose your surrogate agency. Step 2, choose your doctor. Step 3, choose your donor. And finally, step 4, which is the testing phase. This is where every party has to be tested. FDA regulations come into play here. If you are an intended parent using your sperm and a surrogate, you have to be tested, as I mentioned, within 7 days of producing a sperm sample that's going to be used to fertilize the eggs. If you're an egg donor, you need to be tested. Certainly, surrogates are tested. So what we do is, once we have identified an egg donor and a surrogate, we typically schedule an appointment for all parties to be tested. This appointment can be separate days, or sometimes we do it on the same day. So if you're about to meet your surrogate or you want to meet your donor, you can meet them actually on the same visit to the doctor's city. So if I was to be your doctor and you lived in New York, you would come the night before your visit to be tested. You will basically maybe meet the surrogate the night before and the donor for breakfast and come in the morning to complete your testing. Testing has to be done before the treatment starts. We typically like to do it at least a month before the treatment. It takes a couple of weeks to get the test results back. We test for many things. I'm not going to go into detail into the different tests we do, but in general, egg donors are tested for infectious diseases, some genetic diseases, and obviously their ovarian reserve is tested to make sure that they're good candidates. Surrogates are also tested for different infections. They're also tested for conditions that can affect the pregnancy, such as chickenpox immunity, German measles immunity. We also check them to make sure that they have an adequate uterus to carry a baby, despite the fact that their medical records have been reviewed and they have been cleared to be surrogates. Ultimately, the physician will test the surrogate's uterus to make sure that she's a candidate. Despite doing all these tests, there are a percentage of donors and surrogates that they will pass these tests and yet produce a poor outcome. A donor could look great, but then once she takes a fertility drug, she could produce a few eggs and lousy eggs. The surrogate could look great, and then during the treatment phase, something comes up that disqualifies her. It's rare, but it does happen. After the testing phase, then the treatment phase comes, and this is where I'm going to talk briefly and quickly, as thoroughly as I can, about in vitro fertilization. This treatment takes about 5 weeks. We use certain protocols that give us the highest success rates we can expect, and I'm going to talk a little bit about the procedures. So let's start first with, let me see here, this picture. You can see here the human ovary, and in a natural, normal reproductive phase, the ovary produces an egg. The egg is picked up by the tube and is fertilized inside the tube, where the sperm travels the fallopian tube and comes in and meets the egg. So you need a lot of sperm to fertilize one egg. The process of ovulation, however, in women starts by hundreds of eggs starting a race, and only one of them maturing, becoming dominant. This dominant egg kills all the other eggs around and is ovulated. We use this actually aspect of female physiology to stimulate donors to produce eggs. So this is an ultrasound a picture of an ovary. The black circles you see are called follicles, antral follicles. Each of these little follicles has an egg. You cannot see the egg. If you take a sharp pencil and you make a dot, that's how big an egg is. So the egg is contained in these little follicles. Women are born with a set number of eggs, unlike men where we make new sperm every 70 days. Women are born with a set number of eggs. It's usually 1 million to 2 at birth. It's about 400,000 at puberty. The ovaries contain the eggs. And at the beginning of each cycle, bunch of these eggs start growing. Almost every one of them dies except one of them, which ovulates. So if we give an egg donor fertility hormones, which are the same hormones the brain produces, but in larger quantities, we are able to salvage or rescue a part of these eggs that otherwise the donor would have lost that month. The number of eggs we can rescue is determined by the woman's age and by genetics. And that's what makes a good donor different from a bad donor. We would like a donor to have 15 to 20 eggs. So if we count these follicles, we would like her to have 15 to 20 of them. So once we give the egg donor fertility hormones over a period of 2 weeks, we can mature these follicles and mature these eggs and salvage 15 to 20 of them. This picture shows you the same ovary after 10 days of fertility hormones, and you can see how the majority of these follicles are now growing, each one of them having a mature egg. So this process, which takes about 2 weeks, during which time the donor is taking fertility hormones to mature these follicles, reaches the end whereby we are ready to get these eggs out with a procedure called egg retrieval. It's a 10-minute procedure whereby we go in with a needle into the ovaries. We can see the tip of the needle puncturing the follicles, and we can basically aspirate the egg from inside the follicle. The egg, along with the follicular fluid, goes into the tube, and the embryologist can basically pick that egg up. So an egg retrieval takes 10 to 15 minutes, done under anesthesia. The donor doesn't feel anything. We basically aspirate all of the eggs produced during that month. The eggs are then fertilized in a laboratory. The embryologist can pick up the eggs, and then there are 2 ways of fertilizing eggs. We can put sperm around the egg and let the sperm do the job, or we can inject the egg into the, inject the sperm into the egg. That procedure is called ICSI, or intracytoplasmic sperm injection, whereby we can hold an egg. This is the egg, by the way, and we can insert a needle. Imagine how small these things are. This egg is 400 times bigger than the sperm, which is right here inside the tube. And we can inject the sperm into the egg to fertilize the egg. This is where I want to interject and talk a little bit about fresh and frozen sperm. Over the last 10 years or so, and after having done hundreds and hundreds of cases, we have realized that fertilization using frozen sperm is as good as using fresh sperm. So because of the FDA restrictions for testing sperm within 7 days of producing the sample, we have now actually asked our patients to freeze sperm anytime, way before the treatment. And we are using frozen sperm with exactly similar success rates as fresh sperm, as long as the sperm is normal. If it's really poor sperm, we still prefer to use fresh sperm, but if the sperm is normal, we can use frozen sperm to fertilize eggs. So to continue here, once the sperm is injected into the egg or placed around the egg to fertilize the egg, we have basically generated embryos. While this is happening, the surrogate has been taking estrogen hormone to prepare her uterus for implantation. And the uterus, this is an ultrasound picture of the uterus, and you can see the lining of the uterus. And we measure the lining of the uterus, and we would like it to be more than 8 or 9 millimeters. And this is a perfect looking endometrium, which basically is critical in IVF success rates. Once the eggs are fertilized, and you have an egg here that's been fertilized, the next day it becomes 2 cells, 4 cells, 8 cells, and then so forth. We typically wait for an embryo these days to reach the blastocyst stage, which is the 5th day after fertilization. And this is a picture of a blastocyst. Almost invariably these days we transfer blastocysts because we get higher pregnancy rates. We think that, there are two reasons why we prefer to do blastocysts. Number one, we can evaluate the embryo better. We can tell if the embryo is really good. An embryo that has reached this stage is better than if it didn't. Also, we think that the blastocyst attaches to the endometrium better because it's in a more advanced stage of maturation. Once we have the embryos, we then are ready for a procedure called embryo transfer. This is done under ultrasound guidance. The surrogate comes in. Intended parents are welcome to be present, but they don't have to be. A little catheter is basically used to pick up one or two embryos. You can see here the embryos picked up in a little bubble, and then these embryos are introduced into the uterine cavity. It's a 5-minute procedure, no pain involved. Surrogate stays there for an hour, goes home, and it's all done. 10 days after the transfer, a pregnancy test is done. I'm putting this picture here to show you about embryo biopsy. We are obviously capable today to do genetic diagnosis, pre-implantation genetic diagnosis, where we can actually take a cell outside the embryo, pull it out, check its genetics, determine the quality of the embryo before the transfer. There are advantages and disadvantages for this procedure. The advantage obviously is you know what you're transferring. The disadvantage is that this is a pretty invasive procedure, and you could actually damage the embryo, and it can result in lower pregnancy rates. We have gotten much better with this process, and even though there's still a slight decline in pregnancy rates, that gap is really closing in. IVF success rates directly correlated with the number of embryos you transfer and the quality of embryos you transfer. This is our success rates when you use an egg donor and a surrogate at PFC, at Pacific Fertility Center. This was last year. If you transfer 2 fresh embryos of very good quality, you will get 79% chance of having a baby. If you transfer 1 embryo, that pregnancy rate drops by about 12 percentage points to 67. And if you put frozen embryos, 2 frozen embryos gives you about a 62% pregnancy rate. These are presumably good embryos. You can put 10 lousy embryos, you're not going to get a pregnancy. But if you put 2 great embryos, 80% of the time you're going to get a pregnancy. If you transfer 2 embryos, 62% of the time we expect you to have twins. Once the treatment phase is completed, which was step 5, then step 6 is obstetrical care. As the IVF doctor, I typically keep the surrogate with me for 10 weeks unless the surrogate doesn't live close by. If she doesn't live close by, then she can follow her care with her own obstetrician. I recommend very close involvement of intended parents with the obstetrician. Even though you're not the one carrying the baby, it is your baby, and it's important that the doctor who's taking care of that surrogate knows who's the boss and knows who to contact in case of problems, complications, etc. So I really recommend that you keep a close contact with that physician. I think that's it.
All right. Thank you, Dr. Sahakian. We're going to go ahead and answer a few questions right now. Let me just pull this up. Okay, so we've gotten a number of questions, and we can just, Dean, do you want to go ahead and take some of these, read them out loud?
So the first question is about how many people work in our agency. I'm not sure if it means employees or how many clients we have. For employees, there's 32, that's about 20-something in-house, and we have different workers around the country and actually internationally. I would guarantee if we put our employee numbers up against any other agency, we probably have more employees than any other surrogacy agency because we want to keep this as seamless as possible. As for clients working with us, we get about 120 new clients a year. There's roughly 10 new clients a month. The next question is, are there financing or loan options available to help with some or all of the costs? There are some private companies that do loans. We don't have one. I know some IVF clinics have their own financing programs. So there is options available. We can steer you towards them if you need it, and you can apply and see if that works. But there definitely are some banks and loan institutions out there that offer loans. The next question is the cost the same for GSED and gestational surrogacy? It's going to be more expensive to do GSED, and that's because there'll be a egg donor piece, paying the egg donor as well as for travel and medications. There'll be an agency fee associated with finding a donor and matching with the donor. The IVF cost will be more expensive because it's there's a retrieval, et cetera, for the donor and a third party involved. So and when we do that estimate of $125, it probably goes up another $20,000 to $25,000 for the GSED piece because of that added step. The next question is, does the father of the intended adopting couple provide the semen? Yes, he would, unless he has a fertility issue too. There are at least, I would say, 8 to 10 states now where you can do gestation surrogacy where a sperm and egg donor is used. So it is, it is available if both parties have fertility issues. But usually, yes, it's the if it's a heterosexual couple, the husband provides the sperm, and a same-sex couple, either one or both provide the sperm. Let's see. What are the laws like in Illinois regarding egg donors and carriers? We have heard that the donor cannot also be the carrier. Illinois is great for surrogacy in general, in that there's a statute where pretty much little, if any, legal work is needed. You really just fill out forms, send them to the hospital as well as the vital statistics department, and that creates an initial birth certificate, and it's a parentage action. I personally don't like it because there isn't a legal action involved, and I think it's always safer when a court's involved. So what I have most of my couples that work in Illinois do is still do some type of parentage action or adoption in their home state when they're done. As for using your donor as also your carrier, it is still possible in every state, and probably even Illinois. All the parties would have to agree to it. We don't advise to do it. That's what's known as traditional surrogacy. It used to be the only way surrogacy was done in the country, but there's inherent problems with it, and then in that your carrier then has a genetic relationship, so then has more of a right to try and enforce her rights in the end if she does change her mind. As I said, it usually doesn't happen, but if you're in a case where she's the donor as well as the carrier, you enhance your risks in that way. Let's see. The next question is, if the cycle fails because of the quality of the embryos, how much money will we forfeit and how much will we get back? So there's a couple different options. We have, Dr. Sahakian has both of these programs. There's a guarantee program and there's an unlimited IVF program. The guarantee program is more of a situation where you guarantee that you're pregnant by a certain number of transfers. If you're not pregnant, you get your IVF and your circle agency fees back. You'd lose any third-party fees that have been paid, but you get a bulk of your money back. It used to be a very big option for people. We stress the unlimited IVF option more because we'd rather have you have a baby than not be successful and get your money back. But any third-party fees that haven't been paid is what you would be returned. We collect all the carrier's money in advance. Obviously, if she doesn't get pregnant, she's not going to be getting her base fee, and there's certain other third-party costs that would be out. It's tough to give an answer because honestly, it's never really happened that way, except for couples that only want to do a certain number of tries and then want to be out. They lose the agency fee, the donor fee, and that's possible. So we can go over both programs if you want to have a consultation, but one offers all your money back, one offers you unlimited transfers until you get pregnant. Do you have a fertility clinic as part of your complete surrogacy agency? No, we do not have a clinic under our roof. we have forged relationships with doctors like our clinics like Pacific Fertility and Dr. Sahakian, where there is a pretty close relationship and there's specific packages available and plans available only to our clients through his facility, but we don't have one in-house. The next question I'll give to the doctor. It says, what are sperm donors tested for, assuming it's STDs? I don't know if you want to give, I know you gave some background.
Yeah, sure, I can tell you. I mean, the testing for a sperm donor is for HIV, something called HTLV, which is similar to HIV. We check them for hepatitis B, hepatitis C, syphilis, gonorrhea, and chlamydia. So these are common sexually transmitted diseases required actually by the FDA for us to test.
All right. The next question is there a payment plan for all the funds due at specific times? They're usually due at specific times. The way Circle's makeup is when you sign on, there's a certain payment made that gets you through what we call the matching phase. It's made up mostly of matching fees, of Circle's agency fee, of different costs, third-party costs that are going to be paid out in order to get you to match. You then get a second payment would be due after you've matched with the carrier. That's made up of mostly the carrier's fee, if you have a donor, her fee, and whatever the legal fees are associated with the state you're in. The IVF payments are made directly to the IVF clinic usually, or sometimes through us, depending upon your choice. And that's usually made in between those two payments. The next question is, does our estimate cost include the fertility clinic? Yes, if you go to that page that I told you that was linked, the Circle Surrogacy website, and click on the costs, our cost sheet estimates do have page 2 of it talks about the different costs associated with the IVF. So it is totally inclusive in that cost estimate.
But by the way, before I forget this, Dr. Sahakian, anyone who attended this webinar can have a free telephone or Skype consultation with me as well. All you need to do is let me know, and then we'll set it up. Or you can let Circle know, and they can email me, and I'll set it up for you.
The next question is, what is a good overall cost for GSCD, including IVF? I mean, I'd say roughly in the cost sheet, about $140,000, depending upon the program you choose. We always say for planning purposes, just for your own peace of mind, to add 10 to 20%, just for your, just to make sure you're aware it could be that high. It's not to mean it's going to happen, but I would say in between $140,000 and $150,000 is a pretty spot-on estimate of what it'll cost. The next question is, would you work with a 53-year-old single male as an intended parent?
We would consider working with a 53-year-old single male as an intended parent. We look at each case separately when we do a consultation. We're going to want to, just get to know you and understand your situation. It takes a little bit longer for us to match our single parents. So we want to talk to you about that and look at your timeline and what your plans are. But we certainly wouldn't rule that out. We want to have a consultation with you and just see where things are.
Is the PowerPoint presentation available for this presentation? Yes, we'll be emailing it out to all the parties involved, so you'll get a full copy of it. When a surrogate is disqualified during the testing phase, do you still owe her full compensation? No. So even though we collect the carrier's full compensation when you're matched, if you never get pregnant, even if you get past the testing phase and she, has 3 transfers or 2 transfers, she doesn't start getting her actual base fee until a pregnancy is declared around week 8 to week 10 of the pregnancy. So whatever money is there, if you want to work with another carrier, if there's a break, or if you want to leave the program, that money would still be available. The only cost that would be out would be, money spent to fly her to the test, the screening at the IVF clinic after you've matched. This is for Dr. Sahakian. Are there any risks of damaging gamete when injecting sperm directly into the egg?
There are risks associated with this whole IVF process, and the risks are generally quoted to be 2 times increase in congenital anomalies. The base congenital anomaly rate in the U.S. population is about 3%, 3 to 4%, and there are many studies that show that the congenital anomaly rates with this process of IVF could reach up to 8%. However, the process of injecting the sperm into the egg is an invasive procedure, but in good hands, it almost invariably doesn't cause any damage to the egg.
Okay. The next question is, are there ever issues with doctors that don't work well with intended parents? I don't think we've ever had that issue. Where, obviously with any type of relationship, there can be a breakdown. You're going to have a consultation with your doctor ahead of time, and if you want to work with them, you'll work with them. I don't. I'm sure there has been in the past, but it's not something that's common or that really probably rarely ever heard of. Another question for Dr. Sahakian. Is it possible, likely, to have twins from 2 different sperm donors in a single surrogate pregnancy?
Yes, actually I did not discuss that, and I should have. So when you're using a surrogate, you have the option of transferring 1 or 2 embryos. In the case of transferring 2 embryos, you have the option of transferring an embryo from, let's say, one partner and an embryo from the other partner. So what happens in this situation, which is, by the way, the most common scenario, is whereby the donor produces, let's say, 20 eggs. Each partner gets 10 eggs. Those 10 eggs are fertilized respectively by their own sperm, and now we have embryos generated from each partner. On the day of the transfer, a decision would have been made to, let's say, transfer 2 embryos, and then we would pick 1 embryo from each partner, introduce them or transfer them into the surrogate, and if you get a pregnancy with twins, you will basically both have your own child using the same egg donor. You could also certainly divide the eggs in any ratio you want and fertilize them with one partner's sperm and the other ratio with another partner's sperm. But you can also decide whose embryos to transfer. You can say, all right, let's divide the eggs in half, fertilize them with each partner's sperm separately, but then we want to transfer only 1 embryo from partner A. And then partner B's embryos will be frozen to be used later in the future to have another child, basically using the same egg donor's eggs.
Okay. The next question is, how does it work for 2 same HIV couples to have twins? So that's what the SPAR program that Doug touched on. What we would do is set you up with introduce you to Dr. Kiesling in Bedford Laboratories in Massachusetts, which is a doctor who's kind of found the science of cleaning sperm. You go through a couple-day testing process with her to make sure there's no viral load, and she takes a certain sample, washes the sperm, and cleans it out. If you pass these test parameters, you both do, you both could then use each of your sperm to create embryos. The program, we do have carriers that are willing to work in this program. There's never been an issue of a carrier getting the illness from it. He also goes through a process with the doctor to get a rundown and to get a background on the process.
I want to interject this just quickly, just clarify something. You cannot wash the sperm from virus, just so that you understand. What the SPAR program does is, when you are antiviral medications and your viral load is actually undetectable, we have found, and the SPAR program has found, that many of these individuals produce sperm samples, at least sporadically, with actually no virus in it. So what the program does is, they will test your sperm, and if they don't detect any virus, they will freeze that sperm sample to be used for IVF. Occasionally, we've had patients who have produced 6 or 7 samples, and 2 of the 6 have no virus, and we've used those samples. So it's not a washing process. It's not a process where you can actually eliminate the virus from the sperm or the semen. It's rather a detection of the virus.
A question just asked about if they missed the last 75 minutes of the presentation. Is there any way you can get a background of it? We'll send you the audio as well as the PowerPoint presentation so you can see it. I think this question had to do with the last one. Is it, or it looks like, is it possible to make both couples biologically related to the child? If it's a heterosexual couple, yes. If it's same-sex couple, you can create embryos, one of each partner, and implant both embryos. And if you're successful with a twin pregnancy, you both have a child who is genetically related. What's the standard time frame of full start to finish process? For our domestic clients, I think Doug touched on about 15 to 22 months. The matching time, Dr. Sahakian was a little off with our agency. For all of our domestic clients, whether you're doing single or multiple embryo, the matching, the time to get presented with a carrier profile is under 4 months, right around 4 months for domestic, same-sex and hetero. A little longer for single, but I think it's right in that 4 to 5 month range. So roughly 15 to 22 months. Do we have any experience with a same-sex couple in Oklahoma? Actually, yes. I had a couple who had twins in Oregon from Oklahoma. What we would do is match you one of two ways. We'd either match you with a carrier in a state where you're both going to get on the birth certificate through a pre or a post-birth order. However, if you want that more of a protection standpoint, we'd match you in a state where you can do not only both get on the birth certificate, but do a second parent adoption in the state where the carrier lives. And Oregon's one of those states, Massachusetts, Chicago, and Illinois, and there's a couple other states as well. The next question is, can you use your own attorney? It depends on what you're using it for. If it's to negotiate the agreement for services with us, that's fine. If you want to do it for contract negotiation with the carrier, it's probably better to.
Am I on?
Yeah. Sorry to interrupt here. Looks like we have Matt on the call now, so I'm just going to finish up the questions in a little bit. I don't think
I'm on. Can you guys hear me?
Yeah, we can hear you.
Okay, this is Brian, actually. Matt is putting Pearl down.
Okay. Just want to make sure that Brian and Matt got a chance to tell their story and give a little bit of background about their experience, and then, like I said, we'll get back to the questions and just shortly. So, yeah, without further ado, this is Brian and Matt, who are parents through Circle Surrogacy.
So Matt is in the other room, as I said, and we've been listening the whole time. And I can just tell you, we have 2 daughters now. One is 4 months old, and one is 20 months old. We did both through Circle, and it's hard to believe that 20 months ago we didn't have either in our lives. And, you know, I'm hearing all of you talk. It's amazing the amount of expertise that's on this phone. And it sets my head spinning in a good way. And I remember that ultimately it all goes away. You have your child, and you can just tell human stories about it. So I want to talk about the human element of Circle and how that is played out for us, because that is a super important part of all of this. And I came to Circle through a meeting, a chance encounter that I had with John Weltman, and that's before I was with my partner, my current husband, Matt, and certainly before we had a family, of course. And I met John, I was impressed, and I just put his number in my phone, and I kind of went on with my life. And when Matt and I got together, and it was a priority for both of us, we started doing some research. The research quickly took us to California, because as a gay couple in New York, that's what people think you have to do, at least back, when we started the process. We were not impressed. And I love California. I lived out there. I love it. And I thought, well, this would be a great excuse to take trips. So we got out there, and everybody was for our experience, and there's some good organizations, they were just cold and not not really listening to what we wanted, not really hearing what we were saying, not encouraging us to meet the egg donors. I'm sure there are exceptions to that, but not in our experience. We came back feeling a little deflated. And Matt came to me and said, you know, I was doing some research online, and circle surrogacy keeps coming up. And I said, oh my gosh, that rings a bell. And I remembered meeting John Weltman, and I said, I've got to call that guy. I forgot all about him. And we did, and the rest is history. And I can tell you some highlights. You know, it's never complete smooth sailing because you're in uncharted waters for yourself emotionally and physically and monetarily and all of those things. But they were rock stars, like full-on rock stars, every step of the way. We actually got married in Boston because it was not legal yet in New York. And coincidentally, I don't know how many same-sex couples are on the phone, so I don't want to just keep skewing it toward that conversation, but that was my experience. One of the things that really did it with California is it scared me. They you know, Prop 8, they took away the rights that they had passed legislatively, and I thought, the state doesn't have its act together. And Massachusetts had marriage. Massachusetts had John Weltman, who, besides being a great guy, has 2 sons through surrogacy. He's a pioneer and the legal pioneer of everything we're doing here. He did it. He has the bar in every state that he works in, and just a great guy. And I knew that seeing California overturn its legal ability for men and women of the same sex to marry, that scared me. And I knew that we needed legal expertise, aside from the medical and psychological and all of the things that they give. The legal meant a lot to me. So I thought, wow, they're sort of in our backyard in Boston, not too far away. I've met the man before. I'm impressed with his legal background. He went to UVA. I'm a Virginian. He's not, but he went to UVA Law, I believe, and he's brilliant, and he's great, and he's human, and that was a huge deal. Hold on, I have to kiss Pearl. Good night. Good night. And it just fell together in a beautiful way. So we got married in Boston. So we go to Circle, and this was at the very beginning when we had just put our retainer in and we were talking about various things. And everyone there, the entire staff, stopped what they were doing and presented us with a cake. They went out and bought a cake from the people who made, like, the Kennedys' wedding cakes, and they gave us a wedding cake because we just went to the Justice of the Peace and made a sort of small thing of it, and they made a big thing of it. And I just felt like we're home. We met a great surrogate. Fortunately for us, she happened to be in Boston, in the Boston area. So that was tremendous because we had, we could drive up for the big appointments. And, you know, the big appointments are the ones that you know, the day that they, I call it the science day, when, you know, they really inject the blastocyst into the surrogate. We're there. We're holding her hands. We're still friends with her. And we're actually friends with our egg donor. It's very open. That's what we wanted. That was valuable to us. We had one curveball where we had our first egg donor, and the first egg donor didn't create the amount of eggs that we all hoped she would. And the way, the grace and the dignity with which that was handled, when we were very emotional and scared and our surrogate was all teed up, was beautiful. I mean, and I'm actually glad it happened. I know that sounds weird, but we wouldn't have our daughters now if we hadn't had that experience. And it really cemented our relationship with them in the way that it worked. If we could do it again, we would. We're not young. Somebody said 53-year-old single man. Matt happens to be 54. I will be 45 this year. So we're not kids. But it can be done. The doors will open for you. Don't be scared of the financial end of it. It'll all happen if you put your mind to it and your heart into it. And there's a lot of hand-holding there, as much or as little as you need. And that is important. Be certain that they are the best legally. Be certain that they're the best scientifically. They put you in the hands of good people. They're not perfect. No one is, but they handle things with grace, dignity, and speed and whatnot. And they're good communicators, and they listen. So I think that is, I don't know how much that covers or not, but it's important that you remember this is a human experience because there's so much science. There's so much money. There's so much law. You forget it's a human experience, and they have that in spades. They're not a machine. They're people, care about it. And without a doubt, I wholly and emphatically recommend them. And I had a great experience. And we have 2 daughters now to prove, as you know, as testament to that. And you know, it's amazing. And all the drama, all the fear, everything kind of evaporates and goes away. And you have your family. It's pretty exciting.
Thank you so much, Brian. That was great. Can you hang around for just a little bit longer in case anyone has any questions for you?
Sure.
All right, great. So we did block off until 9 o'clock. We have probably, looks like 7 or 8 questions in the chat window right now. We're happy to stay around for a little bit longer and answer those questions. And then if anyone has any additional ones they want to ask, you can go ahead and type those in and hit send, and we'll read them and answer them. But I think we'll probably be going for another 15 minutes or so. Dean, you want to take over?
So the question I was on, and I'll ask it again, and it was, can we use our own attorney? I would advise to use it, really only for the agreement for services stage if you want to, have them look at it and negotiate it with us. But I'd really use just our expertise in 17 years and 700 some odd births to do the carrier agreement and the egg donor agreement. They're flat fees and they're not very expensive. And if someone's never done them before, they're going to spend more money. For the adoption back home or any parental legal work, if you're in a state where you have an attorney and you want to use that person, I'd probably want to talk to them and vet them first. But I have allowed people to use their own attorneys in their own homes, or not allowed them, but people have used their own attorneys in their home states. Does Circle Surrogacy manage the process from beginning to end? That is, are they there to guide you along the way to ease your anxiety? To the best of our abilities, yes. That's what we're here for. But yeah, you're going to have a point person here throughout the process who coordinates. Doug can jump in because he's more of the process piece. But from a legal perspective, yes, we're going to be negotiating things for you, engaging attorneys for you, monitoring legal work and making sure it's done correctly. And even if you need legal work once you have the baby and you've returned home and it's separate from what we've engaged, we assist in the process to make sure documents are sent and things are signed, etc.
And I can speak to that question just because I know that as a parent, having gone through this twice, I had a great deal of anxiety my first journey. Like I touched on earlier, I think it's really important that the surrogacy journey is like no other experience in the world. It's extremely stressful at times, and I really do recommend, like I did, aligning yourself with a therapist at the beginning of your journey, because it's really helpful to have someone to talk to on a weekly basis about what you're going through. We're here to support our parents going through this journey, and I always give out my email and my cell phone number to everyone going through it, to call me when you feel as though you need to be peeled off the ceiling. If I remember waking up in the middle of the night wondering if my surrogate was taking her prenatal vitamins, or wondering if her 16-year-old son was smoking in the house. And at those times you can call and say, hey Doug, I'm having difficulty with this, can you help me through it? But more than that, it's really important to align yourself with a therapist to sort of help you with the day-to-day sort of anxiety and worries going through the journey.
Okay. The next question is, what is the estimated cost for 2 embryo twins pregnancy? It's really the same estimate. Where the costs may increase is if you purchase a carrier, an insurance policy for the carrier, the cost might be higher if she gets pregnant with twins. There's some variable costs that sometimes come in with twins that don't come in with singletons, like bed rests or C-sections. And then your own travel. Usually twins are a little early and they may spend a little more time in the hospital, which just makes your stay in the home state of the carrier a little longer, but really it's roughly the same. I'm going to skip to one question just in case Matt and Brian need to step away. The question is, what doors opened for Matt and Brian to make surrogacy possible?
Can you hear me?
Yep. Yeah.
Okay. Well, we it's daunting because at first you have more questions than answers, and you're nervous and you're trying to save up for it, and we just kept putting one foot in front of the other, and we talked to other people who did it, and we saved and we budgeted, and we knew that they were we knew our destination, and we just kept moving forward. I mean, literally, when a payment was due, we would work it out, and we'd put the payment in, and we would move to the next step. And when we were hit with an obstacle, we would figure out the best choices, and we just felt like we had a good GPS system. We never felt like we weren't driving. That's important to know. You are a good GPS system, and that was important for us. So the doors, they show you the doors. You have to just choose to go through them and trust. We had a great communication with Circle. We had regular contact with our social worker. We had, someone mentioned therapy. I had personal therapy. I just wanted to go through some things myself personally before I was stepping off the ledge and working some things out. So, you know, the 9 months that it takes to have your child is so important. And it's for us, you know, not having the physical presence of a pregnant lady in the house every day to remind you. But you do need that time, and you will go through a lot of, more doors will open and more steps you'll take during that time. And I hope that makes sense. I'm sort of talking about our experience. I hope you can take something away from that. There were some other questions on here, though, on the sheet that we talked about that we touch on about the birth experience, the hospital experience. Could have been better. And actually it improved for the second one, because I think the hospital that we were in Concord, Mass, had more experiences with the same scenario from the time our first was born to the time our second was born. And I just found it was easy. Like literally all the teeing up that Circle does for you, all of that was just easy. We didn't go expecting any combative or negative experiences at all. And we were greeted with, we followed Circle's full-on advice, down to buying the nurses on every shift chocolates. I mean, that really sounds silly, but take their advice. They've been at it a long time. Don't try to invent your own wheel. Trust they know what they're doing. And we're controlling type A New Yorkers. You know, we get things done, but you have to trust the GPS. Just trust it.
Kind of on that question, Brian, another one for you is, you know, I could probably answer it too because I have a daughter, but is parenting girls, they ask, you know, is it harder or you know, weird, for lack of better terminology, for you know, being a same-sex couple, two males?
Well, you know, I don't know. We just wanted healthy, and thank God we got two healthy babies. And I'm from all boys. Matt comes from a family with a lot of sisters. I didn't know the way of girls at all, and it just, now I can't imagine any other thing. Would we ever want a boy? Boy, I think that would be exciting. We think we're done with all of our journeys, but hey, you never know what will happen in life. I love it. I just love these little girls. I just, you know, the capacity to love was never in question. It just when we're blessed with these kids, it's just, they're girls. That's what we have. I don't find any. I'm sure we'll have challenges down the road like any parent, but once you have your child, and I'm speaking to the same-sex people out there, you're just like any other parent, and that's the sobering thing. No one really cares, at least in Manhattan, that you're same-sex, and I think there will be some issues if you're not, but in Manhattan or in a place that has that as a norm, but no one really cares. You're just a parent, and you're going to fall in line. We have most of our friends are straight couples that have kids because it's easy. It's what's around, and yeah.
Okay, the next question is, being headquartered in the East Coast, how do you work managing the process on the West Coast, like California? I mean, we actually have an international client base as well. We have clients from all over the world, in Europe, Africa, Asia. So, you know, email works 24/7. We have employees that work closer to the West Coast time, but really, you know, Doug, Brian, and myself can attest that we answer emails at all times for those questions. And there's not a lot that goes on beyond the East Coast working hours anyway. But we have different staggered workers as well that will work different times to manage those. But we've never had a problem working with West Coast clinic, West Coast clients, etc. Next question, do you offer family balancing or sex selection, and does this process reduce the success rate of pregnancy? We don't really advise to do it, but we don't turn away clients who do it. There's a process called PGD, probably better for doctors to speak it, but it's a process where they can genetically test all the embryos, and they can do sex selection based upon that. We have had clients that have done that. It does, obviously, you're taking a cell out of an embryo that has a minimum number of cells to begin with, so it does somewhat degrade that embryo, but people are successful. Again, that's something you'd want to talk more with the IVF physician if you do a follow-up, just because although lawyers know everything about everything, I don't want to step in the shoes of a doctor. Are there ever issues with an intended mother being too old? 48 years at start time. Obviously, your success rates are much lower due to egg quality and egg creation. You'd probably want to get fertility tested first. And again, this is a better question for an IVF doctor. You can still use donated eggs if you can't use your own, but again, it's a thing you'd want to get tested for first and make sure you can you work with your eggs. Are attorney fees included in the Circle Surrogacy fees? The cost estimate, if you go to that sheet, will have a breakdown of all the different attorney fees. There's separate fees for the, they're all included in the estimated cost sheet, but there's separate fees for kind of the contract drafting and negotiation. There's separate fees for the legal work at the end, usually done by an attorney outside of Circle anyway, so but it is in the estimate and it is collected and paid out on your behalf. The next question is, as Arizona is so anti-surrogacy, where's the best place to go? Really depends on the situation, but Arizona isn't as bad as you think. They had a statute that banned surrogacy. The statute technically hasn't been taken down, but an appeals court case in Arizona struck it down, saying that it was unconstitutional. They never removed it, but we practiced in Arizona with single parents, with gay couples, and with hetero couples, and never had an issue. The best places to go, again, depends on the situation, but there's a lot of great states. Most of the Northeast is great. California is great. Colorado is great. States you wouldn't think, Georgia, Texas, Florida, are great, but really there's 44 states where you can work and do surrogacy. Yes, Maryland's great as well. I just saw that question. Another great state. The next question is, would any change in federal laws for same-sex marriage and adoptions cut down the legal fees? Probably not. Most legal fees are pretty standard. They're almost always going to be under $10,000, usually $5,000 or less. There's a couple of states where there's not, because there's fewer attorneys that practice in this field, they charge more because they're really the only people you can go to. But as surrogacy's really gained popularity, it's just become more mainstream in all the states, there's a lot more attorneys popping up. Working in the ABA, the American Bar Association Family Law Conference, the numbers of the people that attend the meetings for this area of law increase every year, so we're seeing more and more attorneys. So looks like that was the last question. So again, you can reach out, set up a consultation. Alabama, good state for surrogacy. Totally depends upon where the carrier is located in the couple situation. Some counties are great. The ones that are more towards Mobile, Alabama, are more liberal and much better for surrogacy. Other ones are fine, but you have to do an adoption to complete the legal work in Alabama, and it can take a while to situate the birth certificates. But not a, it'll depend on where the carrier is, but not impossible to work in Alabama.
All right, so that's going to be the last question as we're approaching the 9 o'clock hour. I want to thank Dean for giving us his legal expertise, Doug for giving an overview of our program, Dr. Sahakian, and Brian and Matt for joining us tonight. And to all of you, thanks for attending, for your attention, and for joining us tonight. If you have any additional questions, the best person to contact is Bruce Hale, whose email address is listed on the screen right now. It's a legal question. He can answer it, or you can punt it to Dean, and he can sort of ferry those questions off to the correct person. And if you're interested in scheduling one of those consultations that Dean talked about earlier, Bruce is the right person to contact for that as well. So again, thanks for joining us. I hope you enjoyed the webinar, and have a good night.
Good night.
Thanks, Brian.